of how relating this to the flu epidemic and pneumonia. That's one of the representations of flu in the United States, and it is one that, and you can see by the map on the left side where these concentrations occur. And this is one of the concerns that we have. The reason that that information is 2018 as opposed to 2020 is that in the middle of the pandemic outbreak, although the flu epidemic was rising, we suddenly had the start of the pandemic, and the information, the data, where those two things come together is very, very bad. Because what happens is people think it's the COVID or they think it's flu, and they get the two of them mixed very much. So in order to get a map of what we think will be the flu epidemic in the coming winter, we actually have to go back a year because the data is so interlinked in the 2020 period. We really have to go back to the 18 and 17 period and say, what does that distribution look like before we try to relate it to what the COVID distribution looks like. Now, when we started this analysis, we said, oh, this is going to be easy. There was a fellow by the name of Ben Isaac Israel in Israel, who was head of the Israeli space operations, who said, you know, I have a map or a model of peakedness, meaning where does the peak occur in each of these counties? And here's a model to be able to determine that. And we thought, wow, this is terrific. This is going to make our analysis relatively easy. So here's his idea of peakedness. Here's the kind of model that he has with regard to it. And here's the data for counties in the United States. You can see it's very, very messy. And when we begin to map that, we can see that in early February, later in February, later again in February, later again in February, all those red components are where we see what he argued was going to be the peaks of this particular pandemic in the United States. This shows you what's happened in March, what happened later in March, and finally what's happened just before April. So these peakedness would be great if that was correct. But what we found was that it's not correct, and that we start having problems even as we go forward. It would argue that the peak is over sometime in April and significantly declining, but of course it wasn't. And so one of the classic ways in which we usually model these kinds of things is what you might say is an S-shaped curve or a sigmoidal curve. That is, it starts very slowly, it rises very rapidly, it reaches a kind of asymptote and begins to flatten off. And that S-shaped curve is a model that is commonly used to model various kinds of infections of, in the system as a whole. What we found was that that one does not work very well. But there is a modification of it that's called the Gompertz function. And the Gompertz function is a very simple, we'll go through it very, very quickly, but the Gompertz function operationally is very, very simple. It follows the S-shaped curve at the beginning. That is, it starts slowly, rises very, very rapidly, finds a peak, and begins to decline. And the real issue that we found with things that have high infectious components and where we do not know a lot about the ability of the system to manage the infection is the Gompertz curve, instead of declining to zero, the way it started and the way a traditional S-shaped component would, it has what we call a fat tail, meaning that it gets down there, but it never goes to zero. It continues on out in the system. And as a consequence, there are possibilities of reinfection or re-expansion unless we have mitigations that will drive it further down. And so the Gompertz curve is very important to us. Now, if we look at some data in the United States and we try to fit this Gompertz curve to it, there are three elements of the data. One is those curves that are nice and smooth that you can see on the upper side of these components. And this is simply the cumulative infections, okay? This is simply the number of infections over time. They start very rapidly and they begin to level off. It doesn't mean they stop, but they level off. And similarly, at the next set of curves down below, there's a ragged set of continuous decline. That really represents the proportion of increases every year, every month or every week. And you can see there's a slight decline in those over time. And finally, at the very bottom, we have the raw data that would be fitted to a Gompertz curve, where we have the yellow line rising and then falling again. And that's typical of what we expect to see in most infection systems. So we have a cumulative causation, we have daily cases, we have the slope, which is really the number of new infections which are falling off over time. And this gives us a curve that looks very much like a normal curve, except that it has this fat tail on the right side of the curve. And we can calculate the relative slope that's going to happen over time. Again, same kind of information. Again, exactly fitted. This one is fitted to New York and the New Jersey area. This one is the raw case data for New York. You can see the very great variations in daily at the bottom end in terms of daily, but you can see that slope that cuts through those curves. And at the very top, you can see the cumulative effects kind of leveling off. So this is the raw data. This is not what we hypothesize. This is in fact the raw data that we're looking at and fitting the Gompertz curve to it. And so when you do a log linear plot, that's what you have in the blue curve going down there. That's the log linear plot of it slowing down, if you wish, or the rate of increase decreasing. And again, we can fit this to 2 or 3 different things. And this is what's very, very important when we begin to talk about what kind of information are we using. For example, one of the issues tends to be infections. And infections in the early part of the study of the pandemic was reasonably important. But as we test more and more, we know that we're going to get more and more infections. So it does not mean that infections are disappearing. The infection information is still very, very important, but it means that infections may be a messy kind of data as we go forward. As we test more and more, it means that the infection component is going to rise. And even though infections are rising, the testing will allow it to rise even further. So we have rising infections, but also testing affects that data. So the second information that we have that we do not have here, but I'm working on right now, has to do with hospitalizations. That is, people that are sick enough that get into the hospital, this is in the US system in particular, get into the hospital, are tested in the hospital. We know that infection is there. We have confirmation. We know that some of these people get better and some of these people do not get better. They die. So we have a second component of data with regard to hospitalization. That data is a little bit more secure, but it also is questionable because you say, gee, I'm fairly well off, I'm going to go to the hospital, or somebody says, no, I think I'll ride this out because I can't get into the hospital and it's very expensive and I'm not insured. So there is some fuzziness in this data set as well. And finally, the last data set we have is deaths. If you're dead, you're dead. It's not a question of discussion, you're dead. Now, the only discussion there is, did you die because of COVIDs or did you die for some other reason? And the analysis of COVIDs allows us to really make that decision, usually an autopsy, often other information. but that data is pretty good. So we know the number of people dying from COVIDs, and that's pretty solid information. It may be a little inflated at certain times, but it's pretty strong. So the reason raising all those issues is that when we're going to design policy, we have to talk about what kind of information we want to lean on. And so that's one of the reasons for spending a little time on that. Now, when we begin to look at this in the United States, and this is true in China, it is probably true in Pakistan, it is true in very large countries that have a lot of spatial extent. There are differences in different regions. You remember I talked about New York and New Jersey, and then I talked about it spreading across the country. It does not hit the whole country at the same time. Now, it is also true that the United States is a federal system, which means that states are very, very important in the decision process. And there was made an early decision on the part of the central government, i.e. the president, to turn most things over to the states. This is both bad and good. It's good in the sense that it articulates what the issues are in that state and what they should be doing. It is bad in the sense that the rules end up being rules that are different in different states. If everyone stayed put in the state that they're in, this would probably not be a big issue. But if people move around a lot, which they do in the United States, then these regions affect each other. So if we look at the United States as a whole, and sorry, I'm running out of time, but we look at the states as a whole, we can see particular regions. So here's the north central states in the United States, the middle Atlantic. You can see the kinds of distributions that are occurring. And this is over the period up to, including into the end of May. You can see the declines with regard to that slope we talked about. You can see the raw data, and you can see the cumulative effects and the death rates. So we have infections and death rates looking at this. This is now the New England region, the north of the area before. This is the area in the South Atlantic. I would draw your attention to the fact that the slopes are there, the nice curves, but notice that the data is starting to get a lot messier. It's starting to be much more jagged than it was before. And as we go to the southern part of the United States, this is where a lot of decisions were made on the part of governors when they were given either not to close immediately or to not lock down or to leave everything open, or when they did close, be only closed for 2 or 3, 4 weeks and open immediately. And the result is you can see what happens to these daily infections. The same occurs less so in the Midwest. And finally, the North Central. Now, this will give you some idea again of the South. You can see on the right side, the East-South Central Division is getting very, very messy. This is what we call the southern beginning of what we call often the southern tier. And over time, it has been the southern tier in the last month that has created havoc with regard to these models because of all the differences across these states and the fact that they're very, very different than other parts of the country. The Pacific. And finally, I just did something in my region, which is the Washington, D.C. suburbs, and fitting curves to those. Now, this is the end. There's a series of unresolved issues here that are very, very important. One has to do with the differences across the country. So we see New England, the Northeast, being relatively well managed and managed in the sense of they resolve that curve much, much like we expect it to be resolved. The Midwest, also not too bad, but the southern tier of the United States, from Florida through Texas, is in expansion terms a mess. That is, they've been expanding very, very rapidly all the way to Arizona. And so one of the big questions that's coming up now has to do with what we call herd immunity. And this has to do with what proportion of the population needs to be infected so that the infection rate will begin to slow very, very rapidly. And there's lots of counter discussion between some number in the neighborhood of 20 to 25% to a number as high as 65 or 70%. The real number tends to be on the low side, probably, of that. But this affects what we're going to do in what parts of the country. There's probably something close to 20% in Florida at the present time, and very rapid expansions. Last, the thing that drives all of this that we've not looked at, and the Hopkins material does not look at very effectively, is metropolitanization. Metropolitan counties are going to be hit harder than others. It's the density component, and therefore the management issues with regard to it are very difficult and very important. So when we begin talking about policies, we have to differentiate A, different parts of the country, B, different kinds of clustering that takes place, C, issues of metropolitan or concentration. And last but not least, we need to look at what might happen in the coming 6 to 8 months, which is where influenza is liable to be on top of this COVID distribution. And what we know about that. Now, what we found in preliminary data is that we hypothesized that these two distributions would be on top of each other, that where we got high influenza distribution, we would get high COVID distribution. And so far, our data shows that that does not appear to be true, that they're not on top of each other. And that is probably because we have different mitigation strategies for influenza, in particular vaccination. And that's available across the country. It is used in some places more than others, but it creates a different distribution. And therefore, the issue of where this overlap will occur is a major issue and a major question that's likely to occur. And I'm going to stop there. Thank you very much for your attention. It's very, very kind for you to listen to me.
Well, thank you, Kinsley. That was very informative. And, you know, what I really took from that I think is very, very important is the consequences of fragmented policymaking and decision making. And then also near and dear to my heart is the importance of data in trying to sort out the consequences of different policy decisions. So thank you very much. Now we should turn things over to the ambassador. Mustafa, do you want to say a quick word of introduction?
Yeah, definitely. And we are privileged to have Ambassador Tajammul join us today for the session. He is a member of IPS, Institute of Policy Science right now, Policy Studies right now, and a senior research associate over there. Have joined Foreign Service in 1982. He has served Pakistan as a diplomat in several countries. His last assignment was in the Ministry of Foreign Affairs, was an additional foreign secretary. He has held several eminent positions in the past, including Director General of OIC, Organization of Islamic Cooperation. Other than that, there are a lot of portfolio that I can share with you guys, and definitely I would share on the message as well. And I would like, before Ambassador Tajammul start, I would like to say hello to Shumaila, Dr. Shumaila, in fact, James. Today we have a guest, Dr. Shumaila Barni, with us, one of the partnership colleague, and we are very happy to have you over here. We'll definitely discuss with you the things, but Ambassador Tajammul, please start.
Thank you so much, Dr. Mustafa.
Dr. Tajammul, your mic is off mute. Tajammul sir, Ambassador sir, your mic is mute. Yes, now it's okay.
Does everyone hear to me loud and clear?
Yes, now you are loud and clear. Yes.
Thank you. Thank you so very much, Dr. Mustafa Haider, for giving a very generous introduction about me. And let me also express my profound thanks to Professor Kingsley Haynes for giving a very comprehensive, detailed, insightful presentation on what is happening in the United States of America, different aspects and facets of COVID-19 and the way under public policy of United States of America, the situation is being handled. I will be primarily focusing on 4 or 5 areas just to set the discussion. Of course, on the top of line will be how public policy is formulated in Pakistan and how COVID-19 has impacted positively or negatively the public policy in Pakistan. And thirdly, the healthcare system in Pakistan and the impact of COVID-19 on healthcare system, impact of COVID-19 on Pakistan's economy, and the way the government of Pakistan has handled the situation to come out of a dire situation and moving ahead. And then, of course, its impact on society and all that. My main focus will be to link all these things with the formulation of public policy and its processing, formulation, and implementation. And the way could we achieve more in the domain of public policy, or we were not able to achieve results. So this is the whole scenario of my discussion. So I mean, it is no way to tell the practitioners of public policy that public policy is nothing else but generally it consists of the set of actions, laws, and behaviors adopted by a government or more governments to address public issues, provide them basic amenities of life, and look after their welfare in everyday life. If that is the yardstick, then let me also add and supplement that each country has sometimes more than 30 plus policies, which are almost all inclusive and all embracing. And the main purpose of all such policies is to provide maximum facilities, amenities, and benefits to the people of their country. So for all practical purposes, any policy, if it is people-centric and looks after their welfare, then it is a good policy. And we will be looking at plus and minus points of policies, especially public policy, and then heading to other direction. In Pakistan, according to the Constitution of Pakistan, public policy is formulated by the executive branch of the federal government, and then, of course, its processing, its implementation, and formulation all had been done in the past on 2 levels. Because Pakistan had a mixed history of civil and military governments. So most of the time, our policies, you talk about any policy, especially public policy, was tailored, processed, implemented, and carried forward by single entity, that is either the civil government or the military government. So more emphasis in the beginning was one window operation, but subsequently there was a very clear understanding and awareness in once the democratic government started coming in, and in under democratic dispensation, other stakeholders were also involved in the processing, formulation, and implementation of the public policy in Pakistan. Having said that, the next important point in my talk is and should be that we are no more in a stereotype mode of public policy or governance. Now we are passing through different phases where we are simultaneously talking about, say, governance, lack of governance, good governance, or the new governance. All that new paradigms are gradually, incrementally taking their roots in the processing, formulation, and implementation of public policy of Pakistan. With that very short introduction, let me come to one main fundamental question: how has COVID-19 impacted public policy in Pakistan? Professor Kingsley Hans has very appropriately covered this fact that coronavirus or COVID-19 was something novel, new, mysterious, unpredictable, non-understandable, and the world was at loss to understand this pandemic in the beginning. No matter, there were clarion calls coming from different sources. Ebola was one of them. MERS was one of them. SARS was one of them. If I just remember Bill Gates' TED Talk of 2015, wherein he has given a very loud and clear warning to the entire world. Wake up call. If you don't make vaccines right now or in the next few years, the next pandemic is going to kill more than 10 million people. So let us work on vaccine. But forgetting about that preparation part, the world focused on the past history, not looking at 2,500 histories of multiple pandemics which have disturbed the world. And they primarily focused on, well, Ebola has not caused so many deaths. SARS and MERS were also not fatal to the mankind. So they left that thing there, and we are still thinking what is going to happen in making of a vaccine. 6 months, 18 months, 24 months. Experiments are going on, but not a practical thing has come yet out. So under that mixed, confused scenario, we in Pakistan has also different voices coming, divergence of opinion, both at federal and provincial levels, to mitigate, address, and fight against this coronavirus. So in public policy domain, I found a very clear lack of understanding and coordination at different levels of provincial and federal government. Then, of course, second important facet was resistance coming from different strata of society, coming with different voices, thus hampering all the attempts of the government of Pakistan to address, in the beginning especially, this huge pandemic in an appropriate way. Then mistrust was prevalent in the society. Some people, there were different clusters in Pakistan, well-educated people, semi-educated people, illiterate people, and those who are living in far-flung areas, villages, even making question, what is coronavirus? Show it to us. Since it is not an entity, it don't have an embodiment or body. So what you are talking about? So these are different levels of understanding, and a huge mistrust was at play during this whole thing. And that also gave birth to confusion, enormous confusion in the beginning. And things were topsy-turvy. Look at the example of just lockdown. Sindh province was very effective initially in putting a curfew-like lockdown, whereas the central government and Prime Minister Imran Khan were initially against the policy of lockdown, just because they were looking at the demographics of Pakistan, concentration of overwhelming majority of the population who were living in villages, those who were illiterate, those who were daily wage earners, how they can survive if things are locked down, cities, big cities, small cities, and villages are locked down. So the central government was all the time mindful that a complete lockdown or curfew-like lockdown is going to disrupt not only the economy, but everyday life of the poor people, low-income groups, and different strata of society. And then, of course, in another province, that is Khyber Pakhtunkhwa, there was a policy of partial lockdown that was also partially, implementable. People were still defying. I mean, they were not ready to accept the dynamics of a lockdown. And then, of course, later on, when things started settling down, we came to the next level. And right now, especially in the last 2-3 months, we are having a policy of smart lockdowns, putting specific areas or sectors or blocks of a big city, which is in red zone of spread of pandemic, and then trying to relax other areas nearby or far away, not to bring them even under smart lockdown. So all these have their positive impacts, but with the caveat that initially we were caught unprepared even in the implementation of our lockdowns. Then of course, again, a big question in public policy and handling of resources, how to manage testing, tracing, and isolation of the people. There were varied opinions. I mean, initially we were at loss to understand the dynamics of the pandemic, and we were looking how to convince the people to be mentally prepared for, tracing, testing, isolating. And then a huge problem in behavior of educated, semi-educated, illiterate people to combine a wholesome, to make a wholesome approach, a holistic approach to deal with all strata of society at different levels in the country was an uphill task, mostly remained unachievable in the beginning. And then gradually, of course, with the passage of time, we came to understand the dynamics, and now we are in a much better position. That is why, I mean, pandemic started in Pakistan, the early cases by the end of February. And March we were having, beginning of cases, but very low numbers. And then next 2 months were, more cases. So by now, when we are in July, it is something, I mean, which should be, whether it was prudence or some policy implementation or some measures taken by the government, that death rate in Pakistan is still 5,600 deaths plus minus. And likewise, infection cases are 160,000 plus, not more than that. So that shows a country of 220 million population had managed the pandemic initially with a great level of difficulty, then a little easiness, and now in a better position. So all these are related one way or the other with the policy itself. How is healthcare system affected in Pakistan? Let me start by saying that economy of Pakistan or public policy of Pakistan are now handled at 2 levels. One, of course, is federal. Second is provincial level. And especially after the 18th Amendment in Pakistan, most of powers related to public policy or all other domains have been devolved and delegated to the provincial governments. They are responsible for the preparation of their budgets, economic allocations for different phases of life which are required, and then implementation itself. Likewise, even in healthcare, this is right now a subject within the domain of the provincial governments, and center has to take supervisory role or coordinating or regulatory role on the top, and sometimes provision of more facilities and resources to the provincial governments. If I look at, broadly speaking, the existing healthcare system in Pakistan, I mean, this is no hiding from anyone that average spending on healthcare system in Pakistan is almost 2 to 3% of our GDP, which is of course as compared to developed at other fast developed countries or developing countries, somewhere their GDP ratio is 10% at least. So we are not in the bottom, we are at the lower end because of other overwhelming priorities of the government, especially on the top of that, which is sucking resources, is our loans and debts, international loans and debts, and servicing of debts and repayment of debts. And then of course, second important facet is expenditure on the armed forces. Then of course, all other things come later on. So that is our history of 72 years that on healthcare, Pakistan has invested relatively quite limited amounts of its GDP and annual budgets. That is why we were facing an uphill task in the beginning, because healthcare system of Pakistan was not sustainable because of limited fundings. And then COVID-19 itself was a huge challenge, which really put us under stress. And I will let you know how we overcame that problem and through what efforts and agencies we were able to take care of all that. But it is true that having all these problems initially for focusing on the healthcare system, ultimately we evolved a mechanism under which we were able to control and contain and mitigate it even within our health system by getting support from different sources, international agencies like IMF, World Bank, Asian Development Bank, G20, and this is just a few on their suspension of payments of on loans and all that, and additional funding coming from different sources to add up the efforts of government of Pakistan in healthcare system. This is no comparison, but let me put across my point here that under these stressful and testing times, you will bear with me and agree with me that the entire world's healthcare systems were under tremendous stress. Number one, on the level of preparedness. Number two, on the handling of the epidemic itself. Hospitals were overwhelmed, choked. This remained case in the beginning in Pakistan. We were not having capacity in our hospitals, and the government has to establish and create some new hospitals specifically meant for the treatment coronavirus and cases, handling of cases and all that. We were running short of supplies. I mean, there was no concept of masks, sanitizers, ventilators, and other equipment, which we were able to tide over by consistent efforts of the government of Pakistan by getting all these, related materials and equipment from China and other countries. But initially we were having helplessness and unpreparedness. And I was looking, the world was at loss. Healthcare systems of the world were under stress and under pressure and overwhelmed. And there was uncertainty prevailing most of the time. And then gradually we came out of that whole scenario. Then of course, other than COVID-19, Pakistan was facing some traditional problems and vulnerabilities and localized epidemics in the past, like dengue and measles and hepatitis C, and a large number of Pakistani children missing vaccination and all that. So these were separate problems which were already rolling up. But at the same time, COVID-19 pandemic brought a new series of problems and problems. early warnings of coronavirus were not appropriately heeded to, as I pointed out by giving just references of Ebola, SARS and MERS. And even we didn't learn anything from the movie Contagion. We didn't learn anything from all that literature which was coming even right after Spanish influenza, Russian influenza. There are, plethora of books and literature, giving us dire warnings. Something big is going to happen in the world and systems will choke and collapse. So exactly the same happened. But perhaps COVID-19 has now given us new awareness and the way we should look at different dimensions. Our economy was also, my next point, was under tremendous pressure. And that pressure was because of our vulnerabilities, economic vulnerabilities. Those were, supported, reinforced by huge help coming from IMF, World Bank, and other sources, which I have just touched upon. The growth rate of Pakistan GDP in the last 5 years were somewhere between 4.5% to 3.5% in 2019. So this is track record of 5 years. But what happened after COVID-19? We were initially projecting that economy GDP growth will be somewhere around 1.8%. But that was the initial projections. Now we are talking about decline and contraction of the economy, and GDP somewhere touching minus 0.4% by the end of 2020. When I compare this contraction with contraction in big countries like United States of America, mostly European countries, they are now talking about 10 to 15% contraction in their economies and impact. So this impact on economies is going to be vitally huge, no matter it is for United States of America, Europe, third world countries, African countries, and least developed countries. Each country will be having its specific experiences in the domain of impact, negative impact on economies. So we should be getting ready to face both the best or the worst. Under the given situation, perhaps the worst. Coronavirus or pandemic or COVID-19 is going to stay for us for quite some time. There are no early predictions of the pandemic coming to an end. We have to reinvent, revise, rethink, re-understand the whole dynamics of COVID-19, its impact, its effects on countries and bigger picture, and then evolve our all policies, especially public policy, accordingly. Do I have time or should I conclude?
Sir, kindly conclude in 2 minutes.
Okay. So, but let me put one point very clearly, that the government of Pakistan handled the situation, both federal and provincial levels, with quite a good success. And all the measures taken, even with divergence of opinion, were successful at the end of the day. And now we are looking what is going to happen in the future and how we should be prepared to cope with the coming scenarios, situations, whether it is for healthcare system or economy or our everyday life, what is going to happen with the common citizen, low wage workers, our industries, our joblessness. So all that debate has started in the mainstream politics and also in institutions like my institution and all other institutions in Pakistan. But of course, this should be a wholesome exercise only and only if we learn from COVID-19 that a global pandemic was not receiving global response. there were divergent opinions coming, whether I talk about United States of America or China or Europe and others. And if we are now thinking to address COVID-19 under a set of policies in our silos and in our compartmentalizations without sharing or adopting a global approach, I am afraid we are going to miss the train. So my conclusion remarks are, let us join our heads and hands and look something which is going to result in some sort of international and global cooperation. Let us try to put aside different sorts of wars. And you know better than me, whether these are trade wars, hybrid wars, cyber wars, put them aside like we are looking at, there are least incidents of terrorism. We are not talking about hotspots or war zones or conflict zones. If now we are talking about primarily in terms of a system which is going to emerge under coronavirus, so our approach should be looking at all dynamics and then evolve a holistic international global response so that everyone can benefit. If we think you, not me, us or them, then ultimate result will be perhaps a much bigger calamity in the form of the global warming or so many other things. Thank you so very much for your patient listen.
Thank you, Ambassador Tajammul. It was a really treat to have your views, and definitely the way you talk about different the resistance from different strata of the society, definitely with reference to Pakistan, is very a valid point. Now, quickly we switch to the breakup room. Those who are new, especially our two speakers, now we are going to break into 5 to 6 group, and there will be the mixed lot of American and Pakistani students, and they are going to discuss with reference to the topic, and you can have some sort of brainstorming, and then after 20 minutes we come back for the conclusion section. So quickly, I am opening all the groups.
Good. As Mustafa does that, I could, the same as last week.
I have done it. Sorry, I have done it. I'm sorry. I'm sorry.
Zoom is at it again.
Yeah. Now I have learned how to do
Bang.
by talking. Yeah. Everyone, Tehseen Javed is. Let me